Today is store of back pain. In the modern world, office stress has become a constant companion for many people. A large number of employees spend most of their day inside the office where deadlines, targets, and responsibilities create continuous psychological pressure. This stress is not limited to the mind only but also affects the body in several ways. One of the most common issues linked with workplace stress is back pain. Many people think that back pain comes only from poor posture or sitting for long hours, but in reality stress is also a hidden cause that often goes unnoticed. When a person is under stress, the body activates a natural defense system known as the fight or flight response. During this process, hormones like cortisol and adrenaline are released into the bloodstream. These hormones prepare the body to face danger, yet they also make the muscles tense and tight. The muscles in the neck, the shoulders, and especially the lower back remain contracted for long periods when stress is continuous. This constant tension reduces blood circulation, increases fatigue, and eventually leads to stiffness and pain. This is why office workers often report pain in the back and neck during stressful times. Stress does not only tighten the muscles but it also affects posture. A stressed person often sits with rounded shoulders, bends the back unnecessarily, or stays still in one position for too long. Such habits create additional pressure on the spine and weaken the surrounding muscles. Stress also changes the way the brain perceives pain. Small discomfort feels stronger when the brain is already under pressure. Therefore, stress, poor posture, and long hours of sitting together create a cycle that makes back pain worse day by day. Doctors and health experts explain that stress usually shows its physical presence through muscle tension. Chronic stress often brings continuous discomfort in the back, the shoulders, and the neck. In some cases, tension, headaches, and migraines also appear. Long exposure to stress reduces the natural healing capacity of the body. Recovery slows down and mild aches can become long-lasting pain. People may even face muscle spasms, reduced mobility, and difficulty in performing everyday tasks. Research shows that stress management can help reduce stress-related back pain. Techniques like progressive muscle relaxation are highly effective. This practice involves tightening and then releasing each group of muscles in sequence, such as the legs, the back, and the neck. By doing this every day, the body learns to let go of tension. Deep breathing or diaphragmatic breathing also calms the nervous system. Spending 20 to 40 minutes daily on mindful breathing, guided imagery, or meditation can bring significant relief. Mindfulness-based stress reduction is another well-known method. It is an 8-week program where individuals are taught to be aware of the present moment and reduce negative reactions. Studies on office workers show that this program lowers back pain and also decreases stress hormone levels. Cognitive behavioral therapy is also effective because it helps people change the way they think about pain and stress. When combined with mindfulness, it offers long-term improvement in both mental health and physical comfort. Apart from mental techniques, physical measures at the workplace are equally important. Taking micro breaks every 20 or 30 minutes helps reduce static load on the spine. Even a short walk or standing up for a few seconds improves blood flow and reduces stiffness. Choosing the right chair is also essential. An ergonomic chair that supports the natural curve of the lower back keeps the spine in balance and prevents fatigue. If possible, using active seating such as balance stools or adjustable chairs can keep core muscles active and prevent stiffness. Maintaining a neutral upright posture during work is very important. Slumping, slouching, or leaning to one side increases spinal loading and leads to muscle fatigue. Ideally, the back should have a slight natural curve called lumbar lordosis. The head should be straight and shoulders relaxed. Under stress, people often lean forward or hunch over, which adds about 12% extra load on the spine even when the sitting position looks normal. Therefore, paying attention to posture during stressful situations can protect the back from unnecessary strain. The relationship between stress and back pain often becomes a vicious cycle. Stress makes muscles tense, which increases pain, and when pain becomes worse, it creates more stress. This ongoing loop can make life very difficult for office workers who need both physical energy and mental focus. Breaking this cycle is possible only when both factors are addressed together. One cannot rely only on posture correction without stress management, or only on stress relief without ergonomic care. A complete approach is necessary. The conclusion is clear. Office stress is not only a mental challenge but also a hidden factor behind persistent back pain. Long sitting hours, poor posture, and psychological tension combine to put extra pressure on the spine and surrounding muscles. Ignoring these issues may convert a temporary ache into a chronic condition. To avoid this risk, workers must adopt stress management strategies, practice relaxation techniques, improve workplace ergonomics, and maintain healthy posture. By making these adjustments, one can protect the back from continuous strain, improve overall well-being, and perform better at work. A healthy body and a calm mind together form the true foundation of professional success and personal happiness.